So before we begin, I'd just like to acknowledge the traditional owners of the land in which we meet today and pay my respects to elders past, present and future, and also extend that respect to any Aboriginal or Torres Strait Islander people we may have in the room today. Okay, so who am I? Thank you very much for the bio. I'm a proud Mandandangi woman from the Maranoa region. I'm a proud mum of 3 children. I'm also a clinic manager of an Aboriginal medical service in Toowoomba, and I'm an endorsed enrolled nurse and in my 13th year of practice this year. So why am I here? Oopsies. Okay, so firstly because the abstract was successful, thank you APNA, but secondly because I'm passionate about closing the gap in Indigenous, in the health inequalities between the Aboriginal and Torres Strait Islander people. My people suffer greatest health disparity, dying on average 10 years earlier than non-Indigenous. So this is close to my heart. My dad, if he had have lived another 10 years, he may have been able to meet my children or walk me down the aisle. Sorry. So I will always speak out and be an advocate for my patients and my people, even if it puts me out of my comfort zone in situations like this. So I want to be heard and I want to make an impact and a difference in the lives of others. So how can we do this? By sharing knowledge on the importance of early detection and management of disease, the importance of promoting healthy lifestyle in all stages of life, and the importance on taking better steps to protect our Aboriginal and Torres Strait Islander people from the health risks. This is crucial in closing that gap. So what does this look like in general practice? It's a bio, psycho, socio, cultural, spiritual, head-to-toe health assessment, also known as the 715. Okay, so before we can do this, there's a few things we need to look at. So is your practice welcoming? How do you acknowledge that Aboriginal and Torres Strait Islanders are welcome at your practice? Do you have the Indigenous flags displayed? Do you have Aboriginal artwork on the walls? Perhaps an acknowledgement to country in a little frame on the wall. So these are some things that can help the patients feel like you're there to help them and feel welcome and comfortable to access your service and tell you their story. So identification. So every patient in your practice should be asked the same question on arrival. Do you identify as Aboriginal or Torres Strait Islander? How the question is asked and in what context and for what purpose can affect how this question will be answered. So it's a good idea to have a sign on the wall in the waiting room explaining why it's a good idea to identify, to self-identify, because there's services that we can provide you, and this is like allowing us to give you the best access to healthcare. So CTG, PIP, Indigenous Health Incentive. Is your practice registered? Are you signing up your patients for CTG and PIP? It can be worth a lot of money to your practice, and they're questions that you need to be able to answer. Okay, so you don't have to be in AMS to provide Indigenous healthcare. As you all know, you've probably all got patients that are Aboriginal and Torres Strait Islander. Wellbeing for Aboriginal and Torres Strait Islander patients incorporates the broader issues of social justice, equity and rights. Culture can influence Aboriginal and Torres Strait Islander people's decisions about when and why they seek health services. Their acceptance to treatment, the likelihood of adherence to that treatment and follow-up, and the likely success to prevention and health promotion strategies. It's essential that the time is taken to build rapport and engage with your patients, in turn creating an effective relationship. It can only be done with the mutual respect for each other and no judgment. We're all humans after all. So yes, they may DNA regularly, they may not comply, but we need to accept this and move on and be positive and treat each new appointment as a new day and a new opportunity. So commitment to family and community is strong in Aboriginal and Torres Strait Islander culture. Acknowledging this and that they rely on strong family ties as a means of passing on their story from one generation to the next. So this connection can often take precedence over their own health or service delivery in that area. It's also an opportunity to engage and build rapport and relationships with other members of the family. So if they want their whole family at a consult, try and be accommodating where possible. When integrating Indigenous health into general practice, there needs to be grey areas. We need to be able to bend the rules where we can and just do what we can just to make them feel a little bit more comfortable. So the health assessment, 715s. It aims to ensure that Aboriginal and Torres Strait Islander people receive primary health care matched to their needs by encouraging early detection, diagnosis and intervention for common and treatable conditions that cause morbidity and mortality. So why do we do this? To engage, educate and empower the patient to own their own health care. It also assesses what preventative health care, education and other assistance that should be offered to the patient to improve their health and well-being, like immunisations, encouraging behavioural change, and it can be completed every 9 months on every Aboriginal and Torres Strait Islander person from birth to death. So there's mandatory clinical content for a 715. It can be found on MBS Online. There's also this great book that the 3rd edition has just been released, and on the tables there's a little resource piece of paper that's got the website to that and a few other useful websites. So anyone that's unsure of how to do a 715 or what to say, this is specific to best practice for Aboriginal and Torres Strait Islander people. So mandatory clinical content can include things like explaining the process, gaining consent, information collection, overall assessment of the patient, recommending appropriate interventions, providing advice and information, obviously documenting and offering a copy of the assessment to the patient. So who does this? That's exactly right. Perfect. The practice nurses, the Aboriginal health workers, the GPs, anyone that's in that general practice area that can offer help. So we can all be involved in the information collection process and making sure the patient's coming in, having the chat with them, explaining to them why it's of importance to them. So how can you integrate this into your practice? So firstly, we need to make sure our patients are identifying and offering that to them every time they come in. We need to implement a recall system to ensure that the 715 health check is completed annually. And sometimes that's easier said than done. Even in an AMS, we struggle to get our patients in for their annual health checks. But I guess being as opportunistic as we can is the way to go. And we may not be able to do it on the first time. We may need to have, several chats with the patient about why they should do it, but you'll get there in the end. So be persistent, be patient. Okay, so referrals from the 715s, we probably all know this, 5 referrals in a calendar year from a 715. So I guess just think about the at-risk patients. You don't have to be unwell to get a referral, like if they're participating in risky behaviours or whatnot, refer on. Also think about other programs that are available in your area. So engage with your local AMS. They may be able to provide some services for your clients. And remember that it's not about this, like my patient or their patient, it's about accessing the services. And if they're already coming to you for their 715, they're going to come back. Also think like other areas, like Centrecare, they offer programs that for Indigenous services. Your primary health network, engage with them because they will be very knowledgeable about what services are available in your area, and your Aboriginal liaison officer at your local hospital. Another tip that you might be able to do is think about who you regularly refer your clients to. Obviously we have some barriers for our Aboriginal and Torres Strait Islander people, but they may be quite happy to bulk bill your clients off an EPC referral, so have that chat. So what is next? Nurse follow-up. Nurse engagement is essential in achieving health outcomes for all patients. Without this follow-up, the patient is really left to their own devices to implement the recommendations and the referrals following on from their health assessment. It's important to set up the expectation whilst you're doing the health assessment with the patient that you will be following up with them and checking in on them and seeing how they're going with all of those recommendations. We need to educate the patient on the importance of that, and keeping them informed will help promote compliance. So have a chat about how you're going to do that. Will it be just every time they walk into the clinic, whether they've got a sore toe or a cough, or will you be phoning them up, or will they just come in and see you and not the GP? So what we want to avoid is seeing the patient in 12 months' time and doing exactly the same health assessment because they've not followed up on any of those recommendations or gone to any of those appointments. So having those 10987s can help in the sense that you can check up on them. Have you been to the podiatrist? No, I haven't. Okay, well, why haven't you been to the podiatrist? Is there a problem? Is there a barrier? How can we get over that? We often do opportunistic 10987, so when the patient does come in because they've kicked their toes and they need some sutures, I find that's the best way to do it, because sometimes it's hard to get them in to see the GP, let alone just to see the nurse. Why am I going to go if I'm not going to see the GP? And it's about that engagement and rapport, and once you've done that for a couple of months, they know that next time they come in, first person they're going to see is the nurse. So always think about the next step in their healthcare journey. So what did you identify from the 715? Do they need a mental health care plan? Do they need a chronic disease management plan? And focus on that in your follow-up. So, okay, well, remember we discussed that you've got to come in for your care plan. Do you want to book that now? And as I mentioned before, it can take time, so be patient and keep trying. Recalls. Everyone loves recalls. So maintaining the relationship and getting them to come back, and opportunistic follow-ups. The biggest barriers we face with recalls as an AMS is disconnected, incorrect or non-existent phone numbers. So I guess the only way we can overcome that is just to make sure that on every time that a patient presents, every point of contact, that we're confirming their patient, like their demographics, making sure that we've got the right info there. We also make sure that we're always keeping the patient informed on when we're going to contact them or why we'll contact them. For instance, if we do a blood test, we'll call you within 24 to 48 hours. It's going to be on this mobile number, or if they don't have a mobile or they're staying at someone else's house, do you give us permission to contact that person at this number so we can get hold of you? Barriers. Okay, so compliance, health literacy and social determinants are the main barriers we face when integrating Indigenous health into general practice. Often patients need just a little bit more time in a consult. We all have time, right? A little bit more education or knowledge about their conditions, and a little bit more encouragement to complete the investigation or the visit to the allied health specialist, or even just come back for their next step. So other social determinants like transport, financial issues also come into play when we're looking at compliance. They may have agreed to see the diabetes educator or the specialist at the hospital, however they couldn't find a way to get there on the day, so they didn't go. Or they've had transport but they couldn't afford the gap fee, so they didn't go. So ensuring that these issues are discussed and addressed at the point of referring is the only way we can break down these barriers. Identify if the service that's provided is with no charge, and make sure you're letting them know that. Can we arrange transport for the clients? Is there an Aboriginal liaison worker that you can access to help with these issues? So know what services are around you that you can access for support or assistance with that. So health literacy, ensure that your patient has the capacity to understand and act upon the health information and recommendations that you've given them. It's imperative that you ensure that there's no miscommunication and that there's a lack of shared understanding between the GP, the nurse, the health worker or anyone else in the practice that they've engaged with. Utilise Indigenous specific health information where possible, or engage your Aboriginal health worker if you have one, or another Aboriginal and Torres Strait Islander worker in your clinic. Engagement, education and empowerment enables patients to own their own healthcare. This is key in achieving outcomes and closing the gap in the health inequalities between Aboriginal and Torres Strait Islander patients and non-Indigenous. So remember, just don't give up. You can make a difference and you can help close the gap.